knees are the largest joints in our bodies. They're central to almost everything we do. So if you or a loved one is suffering from arthritis or an injury to the knee, everyday activities such as walking, sitting, or kneeling can feel debilitating. But you're not alone. It's one of the nation's most common causes of disability and impacts the lives of 54 million people in the United States alone. One possible treatment option for knee pain is total knee replacement, a procedure that involves removing the damaged bone and cartilage, then replacing the knee joint with an implant to reduce pain and restore the motion and function of the knee. Today, knee replacement surgeries are being combined with a new technology, and it's changing the way knee pain sufferers are treated. Meet MAKO, a robotic arm-assisted technology used by surgeons to perform total knee replacements. This unique technology helps surgeons provide a personalized surgical experience, where each surgical plan is based on a patient-specific diagnosis and anatomy. And in a laboratory study, MAKO Total Knee enabled surgeons to execute their plans more accurately, while also protecting soft tissue and ligaments from damage. Let's take a look at how it works. It begins with a CT scan of the knee joint. A CT scan is a series of X-rays taken at different angles that can help surgeons see things that they can't typically see with an X-ray alone. The CT scan data is used to generate a 3D virtual model of the patient's unique anatomy. This virtual model is loaded into the MAKO system software and is used to create the personalized preoperative plan. Prior to surgery, the surgeon reviews the plan size and placement of the implant, and if necessary, modifies the preoperative plan in order to better position the implant to the patient's unique anatomy. During surgery, the surgeon locates points on the knee in order to register the anatomy in the MAKO system. This process establishes the relationship between the patient's actual anatomy in the operating room and the 3D model that was used during the planning process. This step helps ensure the procedure is executed to plan. Once the anatomy is registered to the 3D model, the surgeon has the flexibility to modify the preoperative plan based on their assessment of the patient's anatomy and range of motion. Then, the surgeon guides the robotic arm to remove the arthritic bone and cartilage from the knee. A virtual boundary provides tactile resistance to prevent the surgeon from removing more than just the arthritic bone identified in the preoperative plan. And visual cues, shown in green, appear on screen to show how much bone to remove. Collectively, these cues help the surgeon stay on the preoperative surgical plan. With the diseased bone gone, a knee implant is inserted into the joint space. And once the surgeon is comfortable with the knee's movement, it's off to the recovery room to begin the journey towards strengthening the knee joint. For more than 100 years, joint replacement surgery has been used to treat patients with chronic hip pain. Today, these surgical techniques are being combined with a new technology, and it's changing the way joint pain sufferers receive care. Meet MAKO, a robotic arm-assisted technology used by surgeons to perform total hip replacements. This unique technology helps surgeons provide a personalized surgical experience where each surgical plan is based on a patient-specific diagnosis and anatomy. Here's how it works. It begins with a CAT scan or CT scan of the hip joint. A CT scan is a series of X-rays taken at different angles that can help surgeons see things that they can't typically see with an X-ray alone. The CT scan data is used to generate a 3D virtual model of the patient's unique anatomy. This virtual model is loaded into the MAKO system software and is used to create a personalized preoperative plan. Prior to surgery, the surgeon reviews the plan size and placement of the implant. If necessary, the surgeon modifies the preoperative plan to help control important measures of hip stability. During surgery, the surgeon locates points on the hip in order to register the anatomy in the MAKO system. This process establishes the relationship between the patient's actual anatomy in the operating room and the 3D model that was used during the planning process. This step helps ensure the procedure is executed to plan. Once the anatomy is registered to the 3D model, the surgeon has the flexibility to modify the preoperative plan based on their assessment of the patient's anatomy. Then, the surgeon guides the robotic arm to remove the arthritic bone and cartilage from the hip. A virtual boundary provides tactile resistance to prevent the surgeon from removing more than just the arthritic bone identified in the preoperative plan. And visual cues, shown in green, appear on screen to show how much bone to remove. Collectively, this helps provide more accurate placement of the implant to the surgeon's preoperative plan. MAKO assists the surgeon in performing controlled and accurate preparation of the hip socket. As the surgeon prepares to place the implant into its final position, the robotic arm guides the cup at the desired angle defined in the surgical plan. With the diseased bone gone, a total hip implant is inserted in the joint space. And that's how MAKO Total Hip is transforming joint replacement.
You have the potential to more accurately place implant components compared to plan with the help of MAKO robotic arm-assisted surgery. Introducing MAKO Total Knee, a key milestone in orthopedic surgery. The MAKO Total Knee application features our clinically proven Triathlon Total Knee system. MAKO Total Knee expands our current MAKO offering to provide a comprehensive solution with proprietary robotic arm-assisted joint replacement technology. The combination of the MAKO partial knee and total knee applications allows you to offer a robotic arm-assisted procedure for your patients for both partial and total knee indications. MAKO now addresses the knee continuum of care and enables you to select the appropriate robotic arm-assisted knee solution for each patient. The MAKO Total Knee application was built upon the foundation of clinical success with MAKO partial knee, which has been shown to be 2 to 3 times more accurate and 3 times more reproducible than manual techniques, which resulted in less pain in the 90-day post-operative period and 92% patient satisfaction at 2 years. MAKO is designed to achieve functional implant positioning, which is patient-specific implant placement as a result of enhanced planning, dynamic joint balancing, and robotic arm-assisted bone preparation. These 3 core features were adapted to enable a MAKO Total Knee procedure with Triathlon. Enhanced planning. CT data is segmented to create a 3D model of the patient's bony anatomy. The MAKO Total Knee application allows you to position the Triathlon implant on your patient's virtual anatomy prior to the procedure. This patient-specific preoperative plan enables more accurate implant positioning to plan. During surgery, bone registration and verification are designed to align the 3D model with your patient's knee. Dynamic joint balancing. MAKO provides you flexibility to modify the pre-op plan. After completing a kinematic assessment of the joint, you can perform intraoperative adjustments to optimize implant placement. Robotic arm-assisted bone prep. The MAKO Total Knee application does not require alignment instruments or cutting guides. Similar to MAKO partial knee, virtual boundaries assist the surgeon in executing bone resections to the final plan. These virtual boundaries have the potential to protect essential anatomical structures of the knee during bone preparation, including the PCL and the popliteal artery. Once bone preparation is complete, you'll place the components using Triathlon instrumentation. In a cadaveric study, on average, MAKO Total Knee final bone cuts and final component positions were 5 and 3 times more precise to plan compared to the manual TKA control, respectively. The changing healthcare environment is creating uncertainty for many. MAKO robotic arm-assisted surgery enables you to have a more predictable surgical experience and offers you a leadership advantage in our evolving healthcare environment. Let's create the future together with MAKO Total Knee.
The majority of orthopedic surgeons around the country do a great job with total hips and total knees.
It's incredible the way you can look at the ligamentous balance as you begin the surgery, make micro adjustments in your plan, and suddenly the ligaments balance. And it's been really phenomenal the way that has worked for us very consistently.
My patients are doing better, they're up quicker, they describe less pain.
We've already been able to schedule 68 MAKO surgeries, so things are progressing even faster than what we thought that they would.
I think the value, the MAKO system, bringing it here as part of our program, adds another element to our center of excellence around orthopedics.
We've already seen an increase in our volume. Patients who are coming to our area who never would have otherwise even considered us.
I think it's a game changer for our patients. They are already realizing and hearing in the community what this technology has to offer them.
You have to go to the big city for more than bumps and bruises, and we're rewriting that story here by adopting new technology.
I'm 58 years old. I was born in Chicago, so I'm still pretty happy about the Cubs. I went to University of Michigan and now live in Albany, New York. 25 years ago, I came out here for an international tax conference and fell in love with it and said, one day I'm gonna own a home here, and here I am. I bought my home here in Scottsdale, Arizona about 7 years ago and absolutely love it. There are 6 great golf courses right here on property, and they're all fun to play. My initial injury to my left knee occurred playing high school football in 1976. During the initial injury, I tore my ACL. That was not, however, diagnosed. 10 years later, they reconstructed the ACL, but I had a series of injuries leading up to that. Well, over time, I was unable to do more and more of the things I really enjoyed. Sports were always an important part of bonding with my son and me. As I had to give up more and more of those activities, it became more and more difficult for us to participate in things we like to do, whether it be baseball, basketball, tennis. At some point, the pain became so unbearable that I really felt it's time to start looking into my options for knee replacement. I had my initial consultation with the surgeon to understand what the surgery entailed, what the recovery period would be, and what the outcome I could expect in terms of the activities I'd be able to continue after the surgery. I didn't know about MAKO until my surgeon told me I'd be a good candidate for a MAKO total knee replacement. My surgeon did a really great job of describing to me the benefits of the MAKO surgery as well as the potential risks, and also why I was a great candidate. I had been putting up the surgery waiting for the latest technology and advancements, and when MAKO Total Knee came out, I knew the time was right. For me, it's important to go to a reputable hospital with a renowned surgeon who is using the latest technology. I was back up on my feet walking with my physical therapist, using a walker the day of the surgery. On the second day with my physical therapist, I was walking with a cane and used that for the next couple weeks. I was very motivated to get back to the activities I enjoyed as quickly as possible, and I realized physical therapy was going to be key. I really stuck to the regimen they gave me and did all my sessions. I'm back to walking and carrying my clubs for 18 holes of golf. I'm back playing tennis again, and I'm even back shooting hoops with my son. My daughter recently got married, and being able to walk her down the aisle was just terrific.
If you are suffering from hip or knee pain, go to meetmako.com or call 414-219-3300 to set up an appointment with Dr. Matthew Wichman, a local MAKO certified orthopedic surgeon. Please refer to the reference card being passed out. Together with our customers, we are driven to make healthcare better.